Hello, hello, hello. And I just went live on Instagram and I realized that my battery is almost dead and the charger isn't working. So if you are on Instagram and want to watch, I would highly recommend that you head on over to YouTube, www.drreaderyoutube.com, because I'm broadcasting there and my battery is about to die. So I'm really excited to welcome you here. And so please come over. Sorry about that. I think the battery is only going to last a few more minutes. So if you're already on YouTube, hello. I've got a lot to share. I've got a lot to share with you. And I just had some notes. I wanted to make sure I don't lose my notes because, yeah, there we go. Okay. Nope, that's not it. Yeah. Okay, where did it go? Today, what's today's date? Okay, there we go. All right. So, hello, hello, hello. And I am here today to talk about a very important topic. So, have you ever blamed your genes on your excess weight? Have you ever blamed your clients and patients blame their genes on the excess weight, the low energy, and other signs of low metabolism? Well, if you've tried a healthy diet or you've recommended a healthy diet to your patients and clients and they're not getting the results that you expect them to get, maybe we need to look at some genetic factors that might be influencing how they are processing food, because that's really what metabolism is, right? It's a process of metabolizing food, how efficiently you metabolize food, how well your body utilizes that food. And we're going to be talking about that today. So, are concerned about your own lowism, your low energy, your inability to maintain optimal weight, if you're working with clients as a doctor, a nurse, a health coach, and your clients are not really their weight issues the way you prefer them to, which is like get to their ideal weight, then this episode is for you. I'm Dr. Rita Marie, and I'm on a mission to transform our broken, very broken disease management system and empower millions of people to go or dysfunction the best life possible. And isn't that what everybody wants? Yeah. And there's so many things that you can do about it. There's a lot of video watching, so I appreciate you being here. And let's get started. So, what is it about metabolism? So what determines somebody's metabolism? People always say, well, I'm overweight because I have slow metabolism. And sure, you will get overweight if you have slow metabolism, but what's the cause? And so a lot of doctors, well, it's thyroid, right? Because the thyroid gland produces hormones that then affect the metabolic rate of every cell. And so guess what? If the thyroid isn't functioning properly, or meaning the thyroid's functioning fine and the seeing the signal, then you're going to have a lower metabolic rate. It controls how well you utilize oxygen at the cellular level. So the thyroid's involved. But the other thing that's involved is blood sugar. Blood sugar is involved in overall metabolic health. How well are we processing the food that we're taking in? Are we insulin resistant? Are we struggling with having missing nutrients that help support the transport of glucose into the cells so that the cells can make ATP, which is the energy currency? So mitochondria affects the metabolic health. If all this sugar goes into the cell, but the mitochondria is not efficient at turning it into energy, then of course you're going to have low energy, you're going to have low metabolic rate, and the weight is probably going to pile on. The other not so much talked about cause, and there's others. I did a whole not a webinar series, but really a 3-day event last year on how the energy metabolism and how that works and the framework for looking at that. We looked at a lot of different parts of the lungs, the cardiovascular system, the respiratory system. But the other one I want to talk about that's missed a lot, although it is brought up a lot when we talk to or go to a doctor and you say, I'm low energy. They right away test your iron and then want to put you on iron supplements if it's low. There's some problems with that too. That's the subject for another video that we're going to do coming in the future, or the near future, actually. But for now, I really want to focus on thyroid, blood sugar, and mitochondria. So what's the role of genes in all this? Why are we all saying, well, my mama was fat and my grandmother was fat and I'm fat, therefore we're always going to be fat? It's in our genes. So what about the genes affects metabolic rate? Well, let's take a look at some of those genes and what you can do about it. And really, the what you can do about it is your main concern, whether you're a doctor, a nurse, a health coach, trying to coach people to get their metabolism boosted, or you're a person wanting to up your metabolism. We have to know what to do about it. And guess what? Genes are definitely involved, and there are things that we can do or recommend people do to support people in getting their metabolic rate up based on certain genes that have. And the other issue is that that's not everything. It's about maybe 5% of the picture. The other 95% is controlled by the epigenetic factors that affect the expression of the genes. Let me just say that again. The epigenetic factors that affect the expression of the genes has more impact than the genes themselves. And certain genetic variants are going to predispose people to gaining weight if they're not careful, to have low energy if they're not careful. Careful about what, you may ask? Careful about the lifestyle choices, careful about the food, careful about stress levels. All of these things play in. So I'm going to focus today on some of the genes that you may want to know about, but more importantly, it's what to do about them. Even if you've never done a genetic test and you don't have access to, say, 23andMe or Self-Decode or some of the other labs that do this, you can still kind of guess that you may have some issues. And some of the things that I'm going to tell you, in fact, most of them, are going to affect you regardless of the cause of your low metabolism. So what do we do? So let me start with the epigenetic of some of these genes. I have a few charts. And by the way, these are charts that we will be giving out at an upcoming event in July. And it's for the public who wants to get their health back. Practitioners come and they enjoy it tremendously, but it's mainly geared towards you if you want to get your health back. And it's called Your Genes, Your Diet, and Your Metabolism. And it is an annual event we usually do at the end of July. And what we do for that is we teach people about the impact of genes and diet on a particular body system or a particular process. And this time we've chosen metabolism. I recommend it if you're interested. We'll put the link in the comments if you request it. So if you request it, if you say, oh, I'd love to learn more about that, Your Genes, Your Diet, and Your Metabolism, end of July, just go ahead and put that in the comments or chat, whatever you want to call it. I always get confused. What platform am I on? Comments, put it in the comments and let's talk about it, because it's going to be an amazing event. We've been doing it. This is our 18, 19, 20, 21, 22. This is our sixth year of doing this event. And it's phenomenal. People walk away with a wealth of information and are inspired and empowered. So let's talk about what to do if you have some of these gene SNPs. So let's talk about thyroid, because so many people are diagnosed with thyroid problems. And here's the problem with thyroid. Most doctors miss thyroid problems. What? Don't they learn that in medical school? My doctor tested my TSH. That's not the way you test for thyroid dysfunction. And even if you do the full battery of tests, the thyroid, the TSH, the T4, the T3, the free T4, free T3, total T4, antibodies, TPO, antithyroglobulin, even if you test all of that and it all comes out normal, the person can still have thyroid problems. They are not crazy and depressed. They are not constipated. They don't need drugs for all of those symptoms. They need to have their thyroid addressed. And there's something called cellular hypothyroidism. And if you check out my podcast, reinventhealthcare.com, there was an episode that I did with Dr. Eric. I can never say his name. It sounds like baklava. But anyway, we did a really amazing interview on the causes of thyroid problems, even when the lab tests are completely normal. So there's a few genes, and they're genes that I like to look at. And if you have a 23andMe, or you're in Self-Decode, or any of those platforms, and oh, by the way, at our event, we're going to be talking about all the different ways that you can get things tested. So there's a couple of them that affect the conversion of T4 to T3. And most aren't even looking at that. They're not even looking at the ratio between T4 and T3. And that's a huge one. If we're going from T4, which is inactive thyroid hormone, into T3, which is active thyroid hormone, and there's something that's blunting that response, we're not going to get enough of the active form, and the metabolic rate is going to be low. So this is a big one to look at, and it's called DIO1 and 2. Okay, so these are the deiodinase, which is the enzyme that does the conversion. The deiodinase enzyme, which helps us to bring the T4 to T3. If they have a gene SNP there and they have low energy, even if they haven't gotten their T3 tested, you can guess that that's the problem. And here's the thing. It's easy to increase that when a couple of things are taken into account. One is that you have enough selenium in the diet. Two is stress levels are modulated. Cortisol, either excess or not enough, will interfere with that enzyme, the deiodinase enzyme. And when it does, then we're going to get low T3 and low energy production. So we have to look at that. Instead, if we don't have enough of this deiodinase enzyme, what's going to happen is the T4 is going to be converted into reverse T3, which is the brakes. I like to think about T3, free T3, as the accelerator, and reverse T3 as the brakes. So it's really important that we look at this. And if someone has a problem with that SNP, then we have to look at what do we do. So the things I mentioned, you can do even if you don't know that there's a SNP. And if you have the SNP, you can do these things safely, even if you don't have the lab test to prove it. It's very interesting. We're not talking here some kind of drug that might have side effects. You have to make sure you absolutely give the right drug. No, we're talking about diet and lifestyle and supplementation. Sure, can you get in trouble by taking too much selenium? Absolutely. Rarely do people do it. And usually I don't recommend selenium as a supplement. I recommend good old-fashioned Brazil nuts. Each Brazil nut has 100 micrograms, right? The other thing I recommend is good old-fashioned meditation. Meditation lowers down the cortisol levels. Meditation stabilizes the cortisol levels. Meditation is super important. So that's what I recommend with this DIO1 and DIO2. A couple of more that I want to mention about from the thyroid is CTLA4. CTLA4 is related to the autoimmune processes. And I'll read you this. It says it codes for a protein that transmits an inhibitory signal to T cells to slow down and prevent autoimmune processes. Did you know that 90 or more % of all hypothyroid cases are related to, guess what, antibodies? It's autoimmune. They call it Hashimoto's if you get the official diagnosis. But it's basically there's a process that's causing a slowdown of your thyroid to produce its hormones or the receptors hormones, right? And the enzymes that do the work. And what happens when that happens? Well, you can get damage to the thyroid and you can get problems. Here's the thing. Everybody should be tested for autoimmune problems in the thyroid if they come and present with low energy, constipation, depression, dry, flaky skin, hair, or any of a group of these, hair loss, group of these. So it's really important to know CTLA4, if you have or someone you're working with has a SNP, single nucleotide polymorphism. We'll go over all of those concepts and terms at our event, your genes, your diet, and your metabolism at the end of July. So basically, if you've got this CTLA4 SNP, you've got the tendency to have an autoimmune condition. And guess what we know about autoimmune conditions? They don't like to be lonely. They like to run in pairs and triplets and beyond. So if we have this CTLA4 SNP, I am adamant with people that they need to protect not just their thyroid, they need to protect their adrenals, they need to protect their mitochondria, they need to protect their gut, and all that autoimmune conditions can happen. And one of the things there is that we have to clean up the gut. I have a whole framework that I taught in your genes, your diet, and your which one? Their immune system. I taught it in that one, and I taught it to practitioners in an event that we had at the end of 2020. That was when we had it, an online event. If you want any of these resources I'm talking about, just comment and we'll hook you up with whatever it is that you need. We'll show you how you can get access. But here's the thing. We've got to address autoimmunity. We've got to address autoimmunity. And there's a framework for all autoimmunity. And then we have a few little specifics depending on where the autoimmunity is hitting. And addressing autoimmunity is going to lead me to another piece that I want to get across, which is why we might have cellular hypothyroidism, even if the labs look normal, even if the blood levels look normal. So there's something called the cell danger response that Dr. Naviad talked about. There's a lot of research on it. But when the cells are in danger, they are shutting down. They are deliberately lowering the metabolism. We are deliberately making less T3 perhaps, or making more reverse T3, but also shutting down the receptors in the cells. Like, no more, sorry, no more T3 for us. Nope, we don't want to upregulate. So here's the thing. The danger that we run into when we take things to stimulate thyroid hormone production or to stimulate the conversion, if we're in the cell danger response, is we can end up with, at a cellular level, with higher metabolic rate that may be used not in the repair process, but in the let's live life process. And that's not good. So the body deliberately shuts some of this down when the cells feel like they're in danger. The last one I want to mention here is one other SNP is the TSHR. It's the TSH receptors on the thyroid cells, the TSH. And so the pituitary can be spinning away, spinning away, spinning away, but the receptors on the cell are not picking it up. So we may have high TSH and low T4, which is the classic diagnosis for hypothyroidism, but we're not addressing it by fixing the problem. Receptors get a little bit, picky about actually taking the hormone in if things aren't right. They need to have good vitamin and mineral levels. They need to have low cytokine levels. So this is important. And then lastly, we need to have the receptors for thyroid hormone on the cellular level to be working properly. That's related to nutrients like vitamin A and B12 and folate. Low homocysteine or high homocysteine will contribute to the thyroid receptors not working. So everything could look good in the blood and it's not getting into the cells because of receptor problems and because of the cell danger response. So I just want you to know this. If you're a practitioner listening to this, this is probably not the stuff you learned about in medical school. This is critical if you want to help these people who have all the symptoms of low thyroid. They don't need T4 prescriptions. They don't need Synthroid. They probably don't even need Armour Thyroid, which is both. What they need is for you to get in there and help them to fix the cell danger response. And I want to move on to one other thing. Well, there's two others, but I think we'll have just one today, is mitochondria are super important. Mitochondria are where the glucose goes into, and then the body, through the Krebs cycle, makes ATP. If the mitochondria are damaged or in danger, they're going to slow down their production of ATP. If we don't have the right nutrients, we may not be able to get through the Krebs cycle, and we stop at glycolysis, which is inefficient. That affects the mitochondria. That affects the metabolism. So it's really important that we look at the mitochondria. And there are a few of those SNPs related. And then I will talk about, because the other one I want to talk about is blood sugar. There's a few SNPs related to that. Most of them are NDUF with a number after them. And that has to do with the working in the mitochondria, working of CoQ10. And CoQ10 is a critical piece in the final stages of producing ATP. So if they have SNPs, if you have SNPs or your client has SNPs in these areas, they're not going to produce enough CoQ10. They're not going to be able to finish the job of creating ATP. And that's really important. So we have to look at that. The last thing I'm going to look at is, guess what? Blood sugar. And I think it's the most overlooked, and it's a really important piece of this. And what happens is most people have completely out of balance blood sugar. How do I know that? Well, I've been working in this field for over 30 years. I've seen a lot of people, and I've tested a lot of blood sugar and a lot of A1C and a lot of insulin, and most people are a mess. There was a study done in 2018 and then repeated, an update of it last year in 2022. And what happened was they tested, and in 2018, we had about 88% of the population was determined to be metabolically unwell, right? On the verge of, guess what? Insulin resistance are already there, diabetes or metabolic syndrome, right? And these are dangerous conditions that have, they're precursors to just about every disease we know of, to cardiovascular, to strokes, which is a cardiovascular disease, even though it's in the head, to hypertension, to cancer, diabetes, of course, and a whole lot more. So we want to help people to get into good metabolic health. Metabolic health is critical for prevention of disease and for reversal of disease. So what are some of the ways that blood sugar is affected, and why is blood sugar so out of balance in people? Have you looked at people's plates lately? I rarely get out in public, and I occasionally get on an airplane, and I watch what people eat at the airport. I watch what people feed their children, and I just want to scream, and I want to shake these mothers and fathers and say, don't feed your kid that. You're setting your child up for a lifetime of metabolic imbalance. And they're most likely going to end up overweight, because like 70% of the population is overweight, and with diabetes or something like it, or bad metabolic health. Those people who are 92% of the population who are metabolically unwell, their blood sugars are completely whacked out, their insulins are high, they are not diagnosed with diabetes yet. Some of them will never be diagnosed with diabetes, but it's not just diabetes is bad for people, for us. It's pre-insulin resistance and insulin resistance. And what do I mean? You've probably never heard anybody talk about pre-insulin resistance. There's insulin resistance, which is a diagnosable condition where the blood sugar is above 100, fasting blood sugar, on 3 consecutive occasions. Metabolic syndrome is insulin resistance with hypertension and lipid abnormalities. But what's pre-insulin resistance? Pre-insulin resistance is when we test people on a deeper level. We can test their A1Cs, we can test their insulin levels, and we can test their postprandial glucose. What's postprandial glucose? You should know that if you're a practitioner, but it's the glucose after meals, right? And how high does it go? Now, I didn't learn a lot of this in school. I learned it from studying and from looking at people, but we have a curve, and everybody knows about the glucose curve. There's a baseline at breakfast, before breakfast. We eat breakfast, it goes up, and it's supposed to come down. And medicine will tell you, as long as it's down to 140 or below 2 hours after a meal, then the person's okay. So all of these people